Welcome back. It is a hot topic for women lately. Hormone replacement therapy. As I said, Dr. Cho was coming back to discuss this topic and what we need to know about this when it comes to our hearts. So welcome back and thank you again for discussing this topic with us. How does, I know when we get to that stage of menopause, how does that affect our cardiac health?
Yeah, that's a great question. So menopause, at the time of menopause, women's blood pressure go up, their cholesterol level goes up. Obviously, we get all the other symptoms too, the hot flashes, the lack of sleep. Some women have their hair falls out, they gain some weight. But for cardiac health, it's really blood pressure and cholesterol and change in weight.
And how does that then, because this whole discussion of hormone replacement therapy, I know the black box label was removed, right? And,
yes.
And it's becoming more of a discussion. How important is that for women to discuss that with their doctor about maybe doing hormone replacement therapy?
I mean, it's absolutely crucial. I think a lot of women want to talk about, well, what's hormone going to do for me, right? So number one, absolutely hormone makes your vasomotor symptoms go away. Hormones also make you sleep better. Some women's mood improves. And there is benefit in terms of weight gain and things like this. Hormone therapy, unfortunately, does not lower cardiovascular risk. So you should not take it for the sole purpose of heart prevention.
Okay.
That's not what it's for. So especially oral hormone therapy. But it's a wonderful therapy for vasomotor symptoms, for sleep, for depression, for hair, for visceral adiposity. There is a couple of groups of women that we should be very careful about. Not all women can take hormones.
Okay, so it's not one size fits all.
Correct. So if you've had postmenopause for longer than 10 years, there's no benefit. You should not be on it. If you've had clots in your legs, or if you've had clots in your lungs, or if you've had a heart attack or stroke, you should not be on hormone therapy. If you have uncontrolled high blood pressure or uncontrolled diabetes, you should really control those things first before you even think about going on hormone therapy.
So it doesn't, I know we say it doesn't necessarily help your cardiac health, but it doesn't hurt it either to take hormone replacement therapy if you are a good candidate for it.
That's right. That's right. So the good candidates for hormone therapy are women who are normal weight, women who are low risk for having heart disease, women who've never had clot. Obviously, breast cancer risk you have to talk to people about. And then the route of hormone therapy is really important too.
This is what I wanted you to get into. So it's the way, whether it's oral or through a patch, it's different. Is one better than the other?
Yeah. Actually, the cream is not systemically absorbed, so that's the safest. Then comes the patch. The patch is safer in terms of heart attack, in terms of clot, in terms of cholesterol, because oral hormone therapy can increase your risk of having high blood pressure, cholesterol, and can cause more clotting disorder. So for most women, I think the gynecologists and the primary care doctors have sort of leaned towards transdermal.
Now, I don't want to leave out the men in this when it comes to hormones. So, but before we do, they brought up a picture of Mona Lisa right now, so I have to ask, she had high cholesterol? Is this true? And how, but how is that known? How do doctors know this?
So, you know, people always think that somehow cholesterol is a recent phenomenon. It is not. So in the 1500s, Leonardo da Vinci painted Mona Lisa with the signs of high cholesterol around her eyes and around her joint. She has cholesterol deposition.
Interesting.
Yeah.
So a lot can be learned, and you can tell that kind of thing just by looking at someone. Now, getting back to the men real quick, testosterone. How does that affect heart health, or is it important for them to be taking that if they're losing that?
So it's really important to be diagnosed. So getting a blood test, it's dependent on whether you have diabetes and all these things, what your testosterone level should be. There appears to be, similar to women, there appears to be a less harm if you're on a cream. Testosterone cream. Now, testosterone pill appears to have a higher risk of having a heart attack, but testosterone cream appears to be better. It's really important because testosterone can increase something called calcification, meaning calcification or hardening of the artery, that we talk to our physician before we start taking testosterone therapy.
I want to quickly ask you, I know we have to go, heart attacks, when it comes to women, do they happen differently, affect women differently than men?
So 70% of women have typical symptoms of pressure, somebody sitting on their chest, but 30% of women have atypical symptoms. So they will get shortness of breath, they'll get back pain, they'll get nauseous, they feel like they're sweating, having cold sweat, radiation down the arm. So 70% women are typical, 30% of women are atypical. The most important thing is if you're having symptoms, don't be your own doctor.
Yes.
Go see somebody.
I am so grateful to have her here. Dr. Cho happens to be my cardiologist as well and is a phenomenal one. If you need a preventative cardiologist, please look her up. I thank you. We could talk all hour long about these topics. I wish we had more
Great.
time, but thank you so much for coming in today.
Thank you so much for having me.
We appreciate you so much. All right.